So in this class, I'll specifically tell how to read the question and how to remove the wrong answers, and then how do we select the correct answer. You have to apply the same techniques in the entire questions. So please read the question 261. So this is the first questions for today. So the nurse is preparing a discharge plan for 65-year-old man with a new diagnosis of congestive cardiac failure. So the discharge order include furosemide 40 milligram by mouth twice per day. The nurse recommend food to reduce unwanted medication side effect. Which of the following food would be most appropriate to include in the teaching plan? So the question how the situation of the question is, patient is 65-year-old and the diagnosis of the patient is congestive cardiac failure, where the patient is receiving Lasix. So one of the choice of treatment for congestive cardiac failure is Lasix or furosemide. It's a loop diuretic. Apart from that, digoxin is the choice of treatment. Fine. So the nurse recommend food to reduce unwanted medication side effect. So here the medication is Lasix or furosemide. And what is the side effect of Lasix or furosemide? And in order to reduce the side effect, how do we, or what is the diet modification which you need to follow? Fine. So that is a question here. So furosemide causes dash, or what is the side effect of furosemide? Furosemide is a loop diuretic, and loop diuretic causes hypotension as well as it causes hypokalemia. It causes hypotension as well as it causes hypokalemia. Okay. So based on that, you can select the answer. I want everyone to participate in question answer session where you can read the answer and select the answer and drop your answers in the chat box so that I can easily analyze. So please drop your answers in the chat box. Please try to remove wrong answer and then select the correct answer. Okay. So here the first option is green leafy vegetables, and second is banana and orange, third is chicken and fish, and third is whole wheat grain. So as I said, like it is the side effect of furosemide is hypokalemia as well as hypotension. So you can provide potassium rich diet. So out of this, potassium rich diet is second. Very good. It's banana and orange. Exactly. So the answer for this question is B. See, when you are attending exam preparation sessions, what is your goal is you have to write down each and everything. Here in this question, what all are the points that you can write down? It's congestive cardiac failure, and put a hyphen, and the choice of treatment of congestive cardiac failure is one is Lasix and second is digoxin. Okay, so you can add a digoxin as well as Lasix. Fine. Then you can write one more thing. What is the side effect of Lasix? Side effect of Lasix is hypokalemia as well as hypotension. Okay, and next you can write down what is a diet modification which is required for a patient who is receiving Lasix. Okay, so you need to write down potassium rich diet. So here it is given like a banana and orange. It is not mandatory to give the same kind of options. You will get many different kind of options, but you need to just give more focus on potassium. Fine. Next question. See, why potassium need to be corrected? What is a basic indication? Why do we need to correct this? Yes. So the first choice of treatment for congestive cardiac failure is digoxin. So in a patient who is receiving digoxin, there will be chances to get digoxin toxicity. So there is one contributory factors where digoxin toxicity increases, that is hypokalemia. Okay, so in case of congestive cardiac failure, there are two choice of medicine will be commonly expected. One is digoxin and second is Lasix. And Lasix causes hypokalemia. The same way, hypokalemia increases digoxin toxicity. So to prevent that, you have to replace potassium. And obviously, yes, potassium variation causes cardiac arrhythmia. So that can also be considered as a triggering factors, or it can be like a contributory factors. But the basic reason why we need to replace or why you need to avoid developing even a small kind of hypokalemia to prevent digoxin toxicity. And in case of digoxin toxicity, obviously, yes, electrolyte imbalance, and it causes conduction variation, and arrhythmias are also expected. Okay. Next question. With the question, a child comes into the clinic with several lesions on the scalp, and the round lesions have dandruff-like scaling with a hair loss. What is the most appropriate nursing diagnosis for this condition? Impetigo, ringworm infection, pediculosis capitis, and scabies. Just drop your answers in the chat box. So look at the picture and select the answer. So you can remove wrong answers. See, there is round lesions in the scalp. So something it is related with the scalp. So you can remove wrong answers. Pediculosis capitis, I think you can remove. That is like a pedicula. What is pediculi? What is pediculi? Is anyone?
Pain.
It is lace. അല്ലെങ്കിൽ തലയിൽ ഉണ്ടാവുന്ന pain. Impetigo. Even you can remove impetigo, right? Impetigo, it is a skin in like changes. Okay. And scabies is also skin lesions. And in case of ringworm, tinea capitis. So ringworm, it is like a ringworm infection. When ringworm get infected in our body, there'll be chances to get round lesions. Okay. This ring infections can occur in the head or anywhere in the body. So there'll be chances to get a round shaped lesions. Okay. A ringworm infection in the head is considered as ringworm or tinea capitis, or ringworm on the head. Fine. So please remember what is tinea capitis. Okay. Next question. A 40-year-old woman suffered an automobile accident 1 month ago. The accident resulted in C4 spinal cord injury. Her preventive care include independent daily performance of coughing and deep breathing. With which range of motion exercise would be most beneficial for this patient? So the situation of the patient is 40-year-old patient. with accident. And C for spinal cord injury. See, basically in case of spinal cord injury, you have to just remember spinal cord always starts from C1. It's cervical 1 and it extends and it reach up to L3. Fine. And from L3, the spinal cord divides and it forms a cluster of neurons. It is considered as quada equina. And from quada equina, different nerve roots are divided into the entire part of the body. That is how the neuron cluster are divided. Okay, so spinal cord, it starts from C1 and it extends like this. Look at this picture. So in case of spinal cord injury, what is expected? For example, if the spinal cord injury that has happened over C1, from the injury sites itself, the function alters, and basically spinal cord are necessary to help to travel the sensation from one to another area. For example, from the brain, the sensations are carried and it is moving into the extremities. So basically spinal cord is acting as a national highway where it is acting or it is helping to transfer the sensations from the brain, which is a motor sensation and which is moving to the extremities. Fine. So see, basically look at this picture. In case of cervical damage, cervical spinal cord damage, what is happening? So up to C4 injury, the color which is shaded with a purple in color, the entire area get damaged or the sensation of this area get altered. That means both hands as well as the shoulder shrunk and shoulder area, okay, that get altered. So there will be chances to get a paralysis from the point of injury. Okay, so in case of spinal cord injury, you can expect the muscle damage or paralysis or weakness or impaired movement will be expected just below the injury site. So here the spinal cord injury was happened at the C4, and preventive care include independent daily performance of coughing and deep breathing exercise. Why? Because in case of cervical C4 injury, the chest muscles get paralyzed and there will be chances to get a swallowing impairment and altered breathing. Okay, so even that is also expected. So what kind of motion or what range of exercise should be beneficial for the patient? Okay, active range of motion, passive range of motion, combined range of motion, resistive range of motion. See, please remember, resistive range of motion exercise is not recommended for any of patients. Okay, so resistive range of motion exercise is usually performed in gym. Okay, ജിമ്മിൽ നമ്മൾ ചെയ്യുന്ന എക്സസൈസുകൾ ഉണ്ടല്ലോ, that is like a resistive range of motion exercise, where in the hospital it is not applicable. So you can remove resistive range of motion exercise. That won't be considered as an answer. So you can remove D answer. D is wrong. And combined will keep it, and active and passive, there are two answers again more. So in case of this, we are not able to provide active range of motion exercise. Why? Because the patient won't be like normally responding and won't be able to perform the activities by himself or herself. Fine. So there'll be chance active range of motion exercise you can easily remove, and resistive range of motion exercise you can remove. So you got the two answers like passive and combined. From these two answers you can select the correct answer. So from B and C, what would be the correct answer?
B, passive.
Yes, it's passive range of motion exercise. Okay, now very good. And please tell me the answer. What could be the basic reason for spinal cord injury? Purnima, what could be the basic reason for spinal cord injury? See, what all are the questions that will be asked from the same kind of thing? I will add everything so you can please make a note. What is the basic reason for spinal cord injury? Anyone? Those who know the answer, you can just turn on your mic and ask. Tell me.
passive exercise
Answer
could
is
be
passive. Allada, anganalla ende question endaanu. The answer for this is passive range of motion. And my question is, what is the basic reason or what is the causes for spinal cord injury? Yes, tell me.
Accident.
passive exercise main ആയിട്ട് കൊടുക്കുന്ന upper extremities ആണല്ലോ. C1 to C4 ലെവലില്. അപ്പൊ അതുകൊണ്ട്
അല്ല എന്റെ ക്വസ്റ്റ്യൻ ഓക്കെ അതെനിക്ക് മനസ്സിലായി. എന്റെ ക്വസ്റ്റ്യൻ ഇതാണ്, സ്പൈനൽ കോഡ് ഇഞ്ചുറിയുടെ കാരണം എന്താണ്, എന്തുകൊണ്ടാണ് സ്പൈനൽ കോഡ് ഇഞ്ചുറി വരുന്നത്? സി ദിസ് ഇസ് നോട്ട് സംതിങ് റിലേറ്റഡ് വിത്ത് ദീസ് ഓപ്ഷൻസ്. Spinal cord injury the cause, basic cause for spinal cord injury. Yes, that is another question. Tell me.
Accident.
Yes, very good. Yes,
fall
accident.
down.
Yeah, what
Fall
kind
down.
of acts? Yeah, it's fall from the height. Okay, so the basic reason for fall from the height. So you will get the questions like this. The patient is brought into the emergency room following a fall from 20 feet, or the patient was in the roof of the house and then patient had a fall, or the patient is like the person who is brought into the emergency room and he was a building worker and he got a fall from 20 feet or 25 feet or 15 feet. Okay, they won't specifically tell that fall from the height. They'll describe the situation, and always situation will help you to understand the condition. Fine. So the basic reasons for spinal cord injury is fall from height. Even in road traffic accident, mainly in road traffic accidents, what are the accidents which causes spinal cord injury? Number one, when a person was driving and just suddenly the car has hit over the stone or over a particular heavy thing or rock. Okay, so or in the tree. Fine. So the running car, when stuck with a particular area, there'll be chances to get same kind of movement in the body, and the head of the driver will just hit over the steering. Okay, so when running car get us stuck with any of object, the same body will also stuck, and then there will be chances to get a movement of only head, and it also hit over the steering. Okay, so the body will be always stabilized because we were like normally while driving we used to wear which seat belt. Okay, so with the help of seat belt the body will be stabilized, but the head is not stabilized, so there will be chances to get a hit of forehead on the steering, and it will happen rapid, and that could be the basic reason why spinal cord, basically cervical injury, will be expected in these two situations. So please remember, fall from the height and like a trauma, head trauma, okay, while on road traffic accidents. These are the two reasons for getting spinal cord damage, that is basically on the cervical spinal cord. Okay, so basically in case of cervical spinal cord damage, there will be chances to get impaired movement of extremities, and shoulder shrunk will be altered, breathing get altered, and swallowing ability get altered, and neck movement get altered, and the movement from the shoulder to end will be completely affected. Okay, so please remember this. And so the exercise for spinal cord injury is passive range of motion exercise. Basically in paralysis, usually we prefer passive range of motion exercise. What is the difference between active and passive range of motion exercise? Active range of motion exercise, with the patient can itself perform the exercise with the respective of like command. When I give command, if patients are able to perform the exercise, is considered as an active range of motion exercise. When the patient is not able to perform their exercise under the command, okay, so that is considered as a passive range of motion exercise. Okay, fine.